Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Bruce Leslie, president of the bipartisan advocacy group First Focus on the Children. They discuss the COVID-19 stimulus that was just signed into law, especially the measure expected to dramatically reduce child poverty in the United States. Let's listen.
Bruce Leslie, thank you so much for joining me.
Thank you so much. Thank you for inviting me.
So today I want to talk about the COVID stimulus bill. And there is something that was sort of hidden in there almost that could really make a huge difference in a lot of people's lives. Could you talk to me about that?
Yes, absolutely. So the American Rescue Plan Act, this has been something a long time coming. For years, we've been working on trying to really get the child tax credit to be made fully refundable. There's about a third of the kids in this country do not receive the full child tax credit because, and this is kind of the crazy thing about it, because their families make too little. And so the credit doesn't kick in until you've made a certain amount of money. And then you don't get the full credit until you make even more money. So consequently, what this bill does is it really makes the credit fully refundable for all children in this country. And it really has an enormous, profound impact on child poverty. According to Columbia University, the provisions increase the child tax credit from $2,000 to $3,000 for kids over the age of 6 and to $3,600 for children under the age of 6. So that's one increase. It makes it fully refundable. That helps that 1/3 that didn't get the full credit even to begin with. And the consequence of that is Columbia estimates will cut child poverty in this country by 45% and more profoundly for children of color. So more than half of children of color will actually have their poverty level cut in half. So it's been a long time coming. There's been a lot of work that went into it. And when the initial proposal that the president was putting together for his American Rescue Plan did not include it. And it was only through advocacy and a push by Congresswoman Rosa DeLauro, who's the chairman of the House Appropriations Committee, did this get in the package. And as you said, it was kind of unforeseen, and it is going to have a profound effect on the future of kids' lives.
Well, I want to back up a little to talk about what a tax credit is. My understanding is that typically, this isn't just something you're going to fill out on your taxes. You're going to get money from the government. Is that right? That
is correct. And one of a major change this bill does is the idea is to try to make those payments monthly. And so if you have children over the age of 6, you should be getting a check of $300 a month for them, and kids under 6 of $350. And now that is up to a certain income level, so it is income related. But the idea is to really help families raise kids. And I think the Department of Agriculture estimates what's the cost of raising a child today. And I think the latest number was $233,000. So it's not going to alleviate by any stretch anywhere close to the full cost of raising children. But that marginal change will really help families. And we know the evidence of cutting child poverty has profound impact on their education, their health, their hunger, homelessness, just an array of positive benefits that we will see because of this.
So this is also, as you said, it has an income ceiling, but the income ceiling is not that low. I mean, it seems like, what did I see? Maybe 93% of children will qualify for this.
That is correct. Yeah. And so it does go up fairly high. And arguments about that having a child tax credit will have impacts on, work is just not true, because if you then get a job, it's not going to kick you out of getting the child tax credit. So there's not this effect of if I get a job, I'm going to lose my child tax credit, because the vast majority of kids will actually get it regardless of their income. So I think that's right. I would say it's probably the biggest public policy change we've made for kids since the 1990s, when we actually enacted the child tax credit and the children's health insurance program.
This is a change in philosophy, right? I mean, you're giving basically guaranteed income to people. Talk to me about how that's a change in philosophy.
Yeah, absolutely. I would say, with Social Security, so for seniors, we've always had that, right? And we expanded that in the 1960s. But then for kids and families, like in the 1990s, there was this whole, movement to reform welfare. And the idea was to actually eliminate cash payments to families and to, quote, incentivize work. Well, one of the things that's really happened, I think, over time is people have found that the child poverty rate is 50% higher than that of adults in this country. And in other countries, that's not the case, because they actually do provide something like a child tax credit, or what other countries call a child allowance. And so I think the research has really shown that providing this actually does not have a negative impact on work. We've looked at evidence from other countries, and then also just the profound benefits of it to really helping families raise kids. And it's important to think about this in two ways, is that there was another study by Columbia that showed they estimate that for every dollar you spend on helping lift families out of poverty, that you get like an 8-to-1 return on investment. So that's really helpful to think about, the long-term benefits of helping supporting families and their kids. But we would argue that while that's important, it's also about the here and now. So we don't make investments in kids just because of what they will become and how they'll become an economic force for the future. We also do it because of them and their here and now. So, and we know that the positive impacts it has on their education, their healthcare, and these other things. And so it really is both. We need to do this to help families for the kids as they are today, but also for this sort of longer term, kind of kids are our future philosophy.
For now, I understand these are temporary. This is a 1-year plan. Do you see this becoming permanent? And can we afford it as a nation?
Yeah, I think that's going to be the next test. I think that there's a lot of feeling, in the child advocacy community this has been a long-term battle for us. And so there's a lot of celebration right now, and that's great. But I think that people do need to realize that we've got to take this next step, which is to make it permanent in some fashion. And I do believe that there's going to be this push to pay for it in the long term. So I think it's a great question as to how that will play out. And so I think it's really important to make sure that this gets implemented well and that people see the benefits of it, and that will help really enable the country to move toward the goal of making it permanent. And then also understanding that there is a return on investment. I think that's where that argument really does benefit us, is that in this next phase, the President Biden's talking about Build Back Better and his infrastructure package. I think we can really make the case that if you can demonstrate that a dollar spent yields this long-term return on investment, it belongs in that package. And so investing in our kids is infrastructure. But again, I don't want it to get lost that we need to do it for that, but also for the here and now. And so making that case to the public and to policymakers, I think, is really important for people to fully understand why this is so important for families in this country.
And once we get used to getting a little bit extra from the government every month, it might be hard to take it away politically.
Yes, that is correct. I think people will see the value of it, and families will, become, I think these monthly payments, I think, will have an enormous impact and really help families in so many ways that then taking that away will be potentially devastating. And, we don't need to, as a country, it's a travesty that we allow the child poverty rate to be 50% higher than that for adults. We should have no poverty. We're wealthy enough as a nation to have a very low to no poverty level for kids. And so this is an important step toward really understanding why that's important for this country. We just have never really engaged in this for kids in the way that we did 50 years ago for senior citizens.
Do you think the income ceiling might be too high?
I don't. I think that it's really important for programs like this to benefit both low-income families, but also the middle class. I think middle-class families are struggling, and helping them is important as well. And again, this doesn't alleviate by any stretch even close to the cost of raising a child, but those marginal costs, we know, for example, there was a study, I think recently, that a $400 expense to a family would devastate them. Like half of Americans cannot deal with a $400 hit. And so this would really help families, both low income and middle class families. And there's arguments to be made that are being made by some that we should actually provide the benefit to all parents with children. And then what you may want to do is raise the marginal tax rate for higher income families. And so you're effectively taxing it back, but creating sort of a universal program makes it simpler. And there's arguments then there's more, support for it that way. But I think that they've sort of reached a middle ground here on that. And I think it's appropriate. I think they've done a pretty good job of trying to reach that sort of middle ground of helping low income and middle class families.
And I understand the COVID relief bill will also pay for more food stamps, which will help the lower income people.
That's right. So other kind of things that's really beneficial is it does increase the food stamp benefit. For a very long time, we've been raising this issue around summer meals. Kids get low-income students get meals at school. And then there's this huge issue around summer. And for years and years, we've been told we can't figure it out. There's no way to do that, et cetera. Well, in these during COVID, I would say the one benefit that's happened is they created something called pandemic EBT. And so there's EBT cards that go out to families to basically supplant what they would have, kids' meals that they would have gotten in schools. Well, now we know we can do it. And they've proven they can do it. And so we should be able to even also alleviate hunger for kids in the summers now, because we can then provide this pandemic EBT card. There's another kind of related tax credit that's important for families is independent care credit, tax credit, so the CDCTC. And that has also been made refundable, and that helps families with their childcare expenses. I'm trying to think, there's also funding for evictions and funding to help support students who are homeless. And that's very important. So there's actually sort of a number of provisions in this act that will really help kids. There's funding for childcare in addition to the CDCTC. And then there's, I'm trying to think, it's like $170 billion for schools and higher education to help low-income families and students and schools sort of become safe, and so that, kids can go back to school safely. And we know that there's been an enormous drop and harm done by sort of all this remote learning and, broadband gaps, et cetera. And so this is real important to get kids back to school safely.
So this looks like this will maybe the silver lining in this pandemic.
Yeah, I think so. I think there's been it's kind of interesting. I think there's been some lessons learned. I think if you look back when this all started, there was sort of this Elon Musk and some other people tweeted, the kids are fine. Kids are all right. Don't worry about the kids. What we've learned is that is not true. Every aspect of the lives of kids have been negatively impacted. And the public has now, I think the public gets that. And you can see in the differences in some of the, like, for example, the relief checks that were in the first pandemic bill provided $1,200 for adults and $500 for kids. And it was part of that, kids aren't, they're only marginally affected. And I will note that another thing in this American Rescue Plan Act is these $1,400 stimulus checks go out to adults and kids equally. So no longer are we treating kids as if their problem is only 40% of that of an adult. There's now recognition that no, actually, this pandemic's had huge impacts on children and their families.
Bruce Leslie, thank you so much for joining me.
Oh, thank you so much. Thank you for inviting me to talk to you today.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.